right, there we go. All right. Hi, everybody. Thanks so much for tuning in today to talk about global vaccine equity. I am Dr. Elizabeth Marnik. People call me Liz. I'm from Those Nerdy Girls and ScienceWhizLiz, and I'm joined today by Jessica Malaty Rivera, a fellow science communicator and champion for Shot at Life, a global immunization advocacy group with the UN Foundation. So hello, everybody. And our goal today is to raise awareness for why global vaccine equity is so important and share some concrete ways that you can all pitch in. So before we jump in, Jess, can you take a moment to introduce yourself?
Sure. Hi, everyone. Jessica Malaty Rivera. I'm an infectious disease epidemiologist and science communicator. I'm a mom of 3 young kids, and I do a lot of science communication here, primarily on Instagram at my handle, Jessica Malaty Rivera. And I've had the great pleasure of working with Shot at Life for the last, 3+ years now as an ambassador. And I've gone to DC with them a couple times for their exciting summit where we talk to lawmakers, and we'll get into kind of what that looks like later in this conversation. But I'm just happy to be here to talk about something I'm really passionate about, which is global vaccine equity.
Awesome. And for those of you who maybe are new to me, I am Elizabeth Marnik. I have a PhD in immunology and genetics, and I do science communication as a hobby, like most of us, in addition to our full real-time jobs, for Those Nerdy Girls, where I'm a contributing writer, and also for my own channel, ScienceWhizLiz. And I am a relatively new Shot at Life ambassador, so I'm excited to learn more with all of you and also help share this information. So we are going to get started now with an introduction to why this topic is important. So Jessica, could you go into why vaccine access is such an important global issue and how much of a problem vaccine equity is?
Yes, for sure. I'm going to give you some stats that I think are really powerful and important to remember as we think about these topics. So let's start with the fact that 1.5 million children, most of them under the age of 5, die each year from vaccine preventable diseases. And that comes out to about a death every 20 seconds. In 2023, about 14.5 million children did not receive a single vaccine. We call those no-dose children, and at all. And 6.5 million kids only received some of their vaccines. The majority of these children are living in low and middle income countries where 99% of the deaths due to vaccine preventable diseases occur in those locations. And so we're talking about a massive crisis in pediatric health and morbidity and mortality. And all of these are because of lack of access to vaccines, all of these deaths, all of these disease situations. And so we're talking about massive ways to reduce harm if we fix this problem. About 85% of high-income countries have introduced HPV vaccines in their routine vaccinations. If you compare that to lower middle-income countries, it's about 25%. So it's a huge disparity. We're not talking about an equal distribution of vaccines, an equal distribution of public health at all. Same kind of goes for COVID. In high-income countries, about 80% of people received at least one COVID vaccine, compared to 33% in lower middle-income countries. So there's a number of ways in which this rolls out in number of other diseases, but these discrepancies also mean that it's causing preventable outbreaks of measles and pneumonia and diphtheria and tetanus and polio. These are causing all kinds of issues for communities, for families, and primarily for children. So on that issue, I kind of want to talk about why these exist. There's a number of reasons, but Liz, I'm wondering if you can talk to our audience about the why behind this.
Yeah, so there's a lot of different reasons for why these disparities exist, and those reasons will vary a little bit from country to country. But honestly, a lot of these issues have deep roots in colonialism. For example, in African countries, centuries of slavery, colonialism, and ongoing exploitation have drained the continent of their wealth and of its capacity to build those systems that are needed to produce and manufacture and spread those vaccines. And African countries have made strides towards their own vaccine production and administration. It still requires a lot of really well thought out trans collaboration to increase access to vaccines, to help them get those vaccines, and then help them distribute those vaccines to locations where they're needed. There are other factors as well, such as the lack of infrastructure. So it is expensive to make these vaccines, and there are not necessarily places on the African continent that can make their own, but we are trying to fix that issue. There's also unreliable suppliers, and then high cost. Like, vaccines are not necessarily cheap, and it can be really expensive for some of these countries to purchase them and then be able to get them to where they're needed to go. And then, of course, we also have political instability and conflict that can make it hard, even if they have those vaccines, to then make sure that they get to that area where they are actually needed. And then when you think about it, when a disease primarily impacts a low-income country, we tend to not want to research it because we have that very selfish motivation where we see it as a problem that they have to deal with and that we don't want to have to deal with. And we saw this with monkeypox, for example. We have the smallpox vaccine, which also offers protection against monkeypox, but we didn't put in the time and effort until more recently to try to get that to areas like the Congo, where they have had ongoing outbreaks. And this is why we really need to start thinking of it as a global issue. Even if it might be a disease that won't necessarily impact us yet, that could change. We need to care about that. So this kind of brings us back to, what are the problems? So those are some of the reasons. So when we think of those problems, how are we able to deal with them? So is this a solution, or does this have no solution, or is there actually things that we can do? And how can we deal with some of these issues? And Jess, could you kind of introduce us to that?
Yeah, I mean, I think it's both an attitude perspective, like an attitude situation, and a logistical situation. So on the attitude, like you mentioned, I mean, if we're not thinking about global health as a global problem, knowing that diseases don't care about national borders, that's going to be the first barrier that we're going to have to overcome. The second is very, very literally logistical. You're talking about some places that are extremely hard to reach, and in vaccine public health language, we kind of call those places like the last mile, getting all the way to the very end with that cold chain intact, reaching those hard to reach areas where children are under vaccinated or unvaccinated at all. It takes a lot of resources to do that. I've had the privilege of working with UNICEF the last few years, and UNICEF happens to be the largest buyer of vaccines globally and maintains that vaccine cold chain and allows them to reach those hard communities without spoiling or compromising the efficacy and the safety of those vaccine doses. Gavi is another example where they allow for private and public partnerships, and they basically pool the resources from donors and from low-income countries to bid down the price of those vaccines, making them more affordable in those places that are lower middle income. And then the WHO as well. The WHO plays a really important role in coordinating some of those logistics, as well as working on the regulations for the vaccines. WHO is responsible for setting a lot of the global standards on providing what the vaccine schedule should be for certain populations, pre-qualifying new vaccines that are being investigated, and then supporting health systems as we kind of live in this era of potential more pandemic threats. So I want to know what brought you to this issue. Why do you care, and why do you want your audience to care about this issue, Liz?
Yeah, I think, as a scientist, a lot of times it's easy to just focus on the data or what's happening in the laboratory. And I think one of the things that really changed my perspective is once I had my own kids, right? I was vaccinating my own children. And it made me start to think about all of the ways in which where you're born makes such a difference in the trajectory of your life.
Yeah.
And it's kind of sad to think about the fact that, like, my kids, I don't have to worry about dying from measles right now, hopefully ever, because they are vaccinated, right? But that's not the same reality for individuals who are born in other countries. And it's not because there isn't a solution. There is a solution. We have a vaccine that can prevent it. It's just getting it to them when they need it. And I think the COVID-19 pandemic taught us all that infectious diseases don't respect borders.
Yep.
And if we really want to keep our own family and our own children safe, that's great. But that also requires us to also care about other people in other places in the world. And they deserve to live healthy lives without worrying about these infectious diseases, just like we do. Yeah. And what reasons brought you to this as well?
For many of the same reasons I mentioned earlier, I have 3 young kids, and I want my kids to understand that at the basis of kind of what we do as members of community is something that we kind of call the social contract, that we all do things that not only benefit us as individuals but benefit our communities. And vaccination is a perfect example of that, of the altruism that is behind a lot of public health mitigation, primarily vaccination, where it's not just to protect yourself. It really is about protecting others, and thinking about us as a global community, knowing that a threat of disease somewhere is a threat of disease anywhere, because as we've seen with COVID-19, as we've seen with bird flu, as we've seen with any emerging infectious disease outbreak, they spread quickly regardless of where you are. All it takes is a person on a plane or a mosquito kind of traveling a far distance, spreading those diseases. And so as a mom, primarily, I want to raise kids who understand that we make choices not just for ourselves, but for the sake of others.
Yeah. So let's talk a little bit about so we've talked a lot about the problem and why it's important, but individuals like Gavi and UNICEF have been doing a lot of work in this space already. So what are some examples of how that has been successful?
So a perfect example of that is the polio outbreak response. So wild polio, is only endemic in 2 countries right now, in Pakistan and Afghanistan. And in 2022, imported cases were identified in both Malawi and Mozambique, and it led to paralytic cases in 9 children. To contain that outbreak, 2 countries worked with UNICEF and WHO and the CDC to mobilize a rapid response, and they vaccinated 50 million children in 2 years. The spread of the speed of that response basically averted any further paralytic cases, prevented the virus from spreading, and then the WHO was able to actually declare an end to the outbreak in 2024. That is pretty powerful, and that shows you the power of specifically a targeted vaccination campaign. Similarly, when polio was detected in Gaza in August, UNICEF and WHO rapidly mobilized their response and conducted surge vaccination campaigns that reached 600,000 children in 9 weeks in the middle of the war. So we know that when polio emerges, it is extremely dangerous because it is a very, very easily transmissible disease. And even in the midst of crisis, vaccination campaigns can be very, very powerful to change the trajectory of an outbreak. Mm-hmm. Another example actually is Ebola. Do you want to talk about the Ebola one?
Yeah. So I just for 1 second though, I think the 9-week stat is mind blowing.
Yeah, it is.
600,000 children in 9 weeks in a war zone is just amazing to think about. And amazing for those workers who did that. So Ebola. In 2018, the Democratic Republic of Congo, the DRC, experienced the 2nd largest Ebola outbreak since the disease was discovered. A lot of you probably remember this. I remember people freaking out and wondering if it was suddenly going to become airborne. It was probably the best time I remember infectious diseases making the headlines as much until COVID happened.
Yeah.
But the disease spread across borders to Uganda, and some estimated that about 290 million people, which was 23% of Africa's population at the time, was at imminent risk from this outbreak. So international partners coordinated by the World Health Organization and included the CDC rapidly mobilized to support the response by the Ministry of Health, and more than 1,500 international staff were deployed, and they set up field laboratories and treatment centers. And then they were able to administer vaccines in these infected regions to help contain the outbreak. And in total, more than 300,000 at-risk people were vaccinated, and the outbreak was successfully contained. And the World Health Organization was able to officially declare it over in 2020. So that's really amazing that by getting vaccines to the needed areas, we really were able to contain what could have been a really devastating outbreak.
Yeah. So what do you think it'll take to achieve better global vaccine equity? And how can people, our people watching today, support this work?
Yeah, that's a great question. And I think, one of the first ways and one of the really important ways is advocating for funding, because this unfortunately takes money to get vaccines purchased and help distribute them. So funding to countries is needed so that they can get the vaccines, but also so that we can help them develop and maintain their own vaccination programs over the long term. And this initially requires investment from wealthier governments like the United States. And then organizations like the World Health Organization, UNICEF, the Global Vaccine Alliance, which we mentioned earlier, which is called Gavi, they are able to take those funds that they get from countries like the United States and use them to help address this issue. Mm-hmm. And they do so in alignment with what is called the UN Sustainable Development Goals, which are abbreviated the SDGs. And these SDGs focus on 17 different areas with the objective of improving society over time by supporting countries in their developmental efforts. So we want them to eventually be able to manage their own vaccination programs. Mm-hmm. And the really neat thing is, as when we think about it, vaccine access directly contributes to 14 out of these 17 goals. So helping individuals and helping countries be able to set up their own vaccination programs is really a key to allowing them to have this sustainable development. Some other things that they can do is that they can, so we mentioned that they need funding. So the way that we can do that is we can advocate for the importance of vaccination locally. And there will be disparities and hesitancy even in other countries, just like we see here. So helping make sure that they have resources to address those as they come up. And then we can advocate our legislator to give money to the World Health Organization, to Gavi, to UNICEF to help ensure that they have the funds needed to do so. And do you want to talk a little bit more about some of the other hows that they can do?
Yeah, for sure. So I've, loved working with Shot at Life. They've made it so easy to get involved in very specific ways to engage lawmakers and my audience and my friends and my family and communities in ways to support global vaccine equity. And so there's a website I'm going to share that's very simple to remember, but we'll also put it in the caption of this video, but it's shotatlife.org/petition. That will allow you to sign petitions to the members of Congress that are in your area and let them know that you support funding the global immunization programs. Unfortunately, public health is kind of systematically being defunded and kind of continues to be. It's going to be especially the case when it's not related to the US, but unfortunately you cannot separate US public health from global health. And so letting the lawmakers in your jurisdictions know that you care about vaccines outside of this country is actually a step to protect you in this country too. And there's a really specific way you can do that by signing those petitions. You can also contact your representatives directly. You can reach out to those elected officials, urge them to support funding global immunization programs. If you live in the US, you can find your elected representatives through usa.gov website. You can search by jurisdiction. You can email them. You can call them. You can even request a meeting with their offices. And Liz and I have both had the privilege of meeting with lawmakers from our jurisdictions and telling them kind of the same things we've been talking about here, personal experiences with global public health and why it's so important. And there's actually a ton of really helpful resources on the Shot at Life website, including scripts. If you don't feel very confident with the stats, or if you need some help with some talking points, it's all there. All the advocacy resources you could imagine, they're all on the website. Highly recommend doing that. It's a very empowering experience, and you'd be surprised how many of the folks who work in these offices are excited to hear from people, their constituents, especially on issues that they're really passionate about. So this is a really great way to get involved in local and large scale issues on public health.
Yeah, and I think, I know the first time I met with representatives, and I've met with them a couple times regarding this issue, but also regarding other issues that I care about. I think it's really scary to think about talking to them. And sometimes you're lucky enough to actually talk to the actual elected official, but oftentimes you're talking to one of their staffers. And usually it's like a 15-minute conversation over Zoom or in person. And really they want to know, why is this an issue that matters to you? And then what are you asking them to do? And the asks are often the hardest part to come up with, but luckily you don't have to. Shot at Life has great resources that you can print, that you can then send to the staffer that you meet with, that clearly outline exactly what we're asking for in terms of budgets that are allocated to these types of things. So it's a really great way to engage with advocacy in an area that you have all the tools provided. And then maybe that will make you a little bit braver to also then engage with your representatives about other issues you care about as well.
Yep. I also highly recommend following Shot at Life here on Instagram, on Facebook. and other places where you are on social media for updates on opportunities to join petitions, to send specific letters if there's calls to action related to a certain global health event. They've not missed a beat. When polio was kind of up in the headlines, with measles, with mpox, they have not missed a moment to remind folks of a way to engage with their local constituents, their members of Congress, and get involved in the work of supporting global vaccines.
Yeah, and for those who really do want ways to learn more, Shot at Life, if you go to their website, they also have training resources. You can jump on webinars. So depending on how much time and effort you have to dedicate to this issue, you can really go from just sending an automatic petition all the way up to getting trained to do more advocacy work, which is great. Are there any other resources that you think that we should share with individuals?
Yeah, I mean, I think we've listed almost all of them. I would say that to stay tuned for more updates from Shot at Life here on social media. I'm always sharing them when they come up on my desk as well, because the next few months will probably be very interesting as far as legislation goes. And so we want to make sure that folks feel more empowered to contact their representatives, even in the midst of a lot of transition. Now is the time to let folks know that we haven't forgotten about global vaccines. So I would watch these channels closely for updates, and also reach out to me and Liz in our DMs or our comments if you have questions about specific topics that we've talked about today, or even just specific campaigns that we can get you involved in.
Yeah, and if you're watching from another country, you can also there's still things that you can do. Gavi takes donations, private donations from individuals, so you can donate directly to Gavi if you're interested in that. Other countries also, depending on the country that you're in, places like Canada also help support these efforts that we talked about. So if you send us messages, I can help connect you to individuals in your country and resources in your country that can help you advocate for this issue as well.
Yeah. Definitely want to drive folks to the Shot at Life social media channels, to their website, specifically to those petition pages, because it will be a wealth of resources for you, especially if you're just getting started in advocacy.
Yep. And you can do the Shot at Life is a shot, SHOTATLIFE. So at is the actual word at, not the abbreviation. Okay. So thanks everyone for tuning in today. To stay in touch with me and those nerdy girls, you can follow us on our social media channels at Those Nerdy Girls, or at my own social media channel, which is ScienceWhizLiz. Those Nerdy Girls also has a Substack newsletter, and you can subscribe to that for free. And then you can also, if you want to contribute to that, you can, to get some additional perks. You can also check out our archives, where we have lots of topics, including a longer form post about global vaccine equity that I wrote that have a lot of these links already embedded there. And I will put that in my stories for you to easily access. And then Jessica, can you tell everyone where they can find you?
Yep, you can find me here on Instagram at Jessica Malaty Rivera, where I post semi-regularly on topics of emerging infectious diseases and public health, and also provide updates from a few places that I am affiliated with, including Johns Hopkins and Public Good Foundation. So stay tuned for more updates. There's going to be a lot of discussion on global vaccines in the next several years. So
it's going to be a wild ride.
Yeah.
And then please do follow Shot at Life. I will link their pages, and Those Nerdy Girls will link as well. They have Instagram, Facebook, all of the places that you can imagine. They're also there. So please also support and share their platforms. And thank you for being here.
Yep.
And stay safe out there.